Hello, this is Dr. Gay from First Look MRI, and this is a 71-year-old female with chronic shoulder pain here. And we can see on this view she does have a finding here in the very bottom of her shoulder joint, a little loose body. But that's not why I'm showing the case. It is because of this. On the top, we have this region of mixed low T1 signal intensity over the bursal surface of the supraspinatus tendon. It looks like a bursitis. And on this PD fat set sequence, it looks pretty bizarre. We have these funny cystic changes over the bursal surface, maybe even within part of the superficial supraspinatus tendon fibers. And then distally, there's some area of low signal. So this looks like a really severely inflamed bursa. So it looks like a calcific tendino-bursitis, one of the more advanced cases I've ever seen, where instead of having a nice simple little fluid collection over the top, or a really uniform inflamed bursa, we have this loculated, really bizarre looking bursa. And you can see that there is low signal here, so we want to look on the x-rays to see is there calcification in there, and if there is, then it'll be a simple case of calcific tendino-bursitis with just this unusual inflammation. Before that, though, I'll put on a T2 weighted sequence here. We see the supraspinatus muscle, supraspinatus tendon. Looks like the tendon is intact, and so this stuff really is predominantly over the bursal surface, may dissect into some of the bursal surface fibers. So it does look like a case of calcific tendino-bursitis, but again, just much more advanced than I usually see. And here's this low signal. So now we're going to put up the x-rays to see is it calcified, and sure enough, there it is. So scoot it down, and we can see here that there's calcification over the bursal surface. Here's that ossified loose body. And so this is a case of calcific tendino-bursitis, but just much more fulminant than we typically see. One more look here on the sagittal images. We see that there's mass effect from the process as it expands outwards and it displaces the deltoid muscle, and there's edema within the deltoid muscle belly secondary to this. So advanced calcific tendino-bursitis.